Dear students, welcome back. Now we are going to see the roots of right and left lungs separately here. So I have already mentioned this roots of lungs in the mediastinal surface of the right and left lungs. Again, we are going to see this thing individually for better understanding. So this is the right side root. This one is the right side root, and this is the left side root. Okay. Next, so what are the structures passing through this root of right side and as well as the left side? And first of all, we'll see what is meant by root. It is a short, broad pedicle which connects the medial surface of the lung to the mediastinum. It is formed by the structures which either enter in or coming out from this hilum. The roots of the lung lies opposite to 5th, 6th and 7th thoracic vertebrae, and the contents of the root is mainly with the principal bronchus. So this one is the principal bronchus here. This is the principal bronchus. In the left side we can see the principal bronchus, whereas on the case of right side it is the principal bronchus is divided into two branches. One is the eparterial branch and hyparterial branches of bronchus. So these two will enter into the hilum. One is the eparterial bronchus, another one is the hyparterial bronchus. And one pulmonary artery. So this is the pulmonary artery which carries impure blood. So this is the pulmonary artery, and two pulmonary veins. One is the superior pulmonary vein, inferior pulmonary vein. Again on the left side also superior pulmonary vein and inferior pulmonary vein is present. Okay, and then bronchial arteries, one on the right side and two on the left side. So here you can see this bronchial vessels around the principal bronchus. So on the right side only one bronchial artery is present, but on the left side you'll have two bronchial arteries and one bronchial vein in between them, and anterior and posterior pulmonary plexus. So this yellow color is always related to the nerve supply. This one is the anterior and posterior. So this one anterior and posterior nerve plexus. Okay, and these are called as pulmonary plexus. And also next important thing is the lymphatics of lungs. So lymphatics of lungs, so it is present here. The posterior aspect of the hilum will have this lymphatic vessels and the bronchopulmonary lymph nodes. All the lymph is drained finally to this bronchopulmonary lymph nodes. Okay, and next one, this elongated position of the lung, this one is called pulmonary ligament, and this is filled with areolar tissue. So these are the structures which are present inside the root. And to understand it better, so this one here you can see this divisions. So the upper part is superior, lower part is the inferior, and this one is the anterior portion, and this part is the posterior portion of the right lung. When come to the left lung, this becomes the anterior and this becomes the posterior, and this is the superior and inferior. So whatever the structures we have studied is based on this present presence of all these positions, anatomical positions. So whether it is present superiorly or anteriorly, posteriorly or inferiorly. Now we have seen all these structures. Now we are going to see this arrangements. So now we are going to see all these arrangements in this thing. So some structures are similar on both right side as well as left side. So from before backwards, that means anterior to the posterior, from before backwards. So one is the pulmonary, superior pulmonary vein. So here also you'll have superior pulmonary vein. And then the pulmonary artery, you'll have the pulmonary artery. And then the bronchus. Okay. So from anterior to posterior, the same type of arrangement also here on both the sides we'll see. If you see on the right side, from above downwards like this, from above downwards. So what are the structures on the right side? First one we can see this eparterial bronchus, and then pulmonary artery, and then hypoarterial bronchus and inferior pulmonary vein. So coming to the left side, what are the things? So on the topmost pulmonary vein, and then bronchus and inferior pulmonary vein. From above downwards, these are the structures present. Okay. Now relations of the root. So these relations of the root, you people already studied in the previous sections. Okay. What are the anterior relations, posterior relations, superior and inferior relations for both right side and left side? The same relations you can mention here it also. Okay, so inside how these structures are arranged is very, very important. So you can go through this one for a quick review. Thank you.